Hi, this is Nell Tharp. I'm going to be talking today about use of suture scissors. We're going to be able to hold them either in our dominant or non-dominant hand without putting fingers and thumbs all the way in the rings. So we're stabilizing the scissors using a ring finger just barely in the finger ring, middle finger kind of tucked in this notch, and index finger out on the tip to provide stability, and then the thumb against the ring, slightly in it, to be able to open and close. What this does is it gives us a great deal of stability as we use the scissors. They can get rotated around for the opposite direction if you need the curve up, and the point allows us. Now, some people, when they're cutting suture, always like to keep the screw upwards, and that can be easier. Another way of holding the scissors to cut suture is like this, which means when you are in your, depending on your hand, you want to be sure to grind the blades together. So I find this technique works best in the left hand. I'm going to go ahead and switch here. So you're pushing up with your fingers. Fingers are just against the ring. They are not in the ring. And then you have your index finger kind of curled around, and you push down with your thumb. And this will grind the blades together. And all you have to do is be able to snip the suture. This is how I recommend one technique. There are other techniques. This is what I find works for me. There are some people who can use the suture scissors like this with their left hand. However, it does require different pressures, because if you do exactly the opposite of what you do with your right hand, you'll actually be pulling the blades apart rather than pulling them together. That's it for our scissor handling, and I hope this was helpful.